Octagos Health is a cloud-based platform that aggregates remote and in-person data for implanted cardiac devices, wearables, and remote physiologic monitors. We leverage bidirectional EHR integration with our industry-leading Atlas AI. We support that with IBHRE certified technicians to provide timely and accurate reports to clinicians.
We're super excited to have everybody here this fine morning in Gaylord, Orlando, Florida. Today we're going to be really talking about remote monitoring. We're talking about implantable monitoring, wearables. We're going to talk a little bit about your practice, so super excited about that. I'm Shanti Bansal. I'm CEO of Octagos Health, the founder as well. You're going to hear from a lot of our team members. You're going to hear from some really amazing guest speakers here today as well. But first, I'd love to just pass the mic around and hear a little bit about your story.
Hi, I'm Andy Kaplan, electrophysiologist in Phoenix with Phoenix Heart, Director of EP, and this is the second meeting that I've had the opportunity to attend. In the meantime, our group has signed on with Octagos and we'll be going live in November. We're very excited about what it's going to bring to us in terms of better monitoring and better tracking of disease states.
Hi, I'm Melinda Newman. I work with Phoenix Heart. I'm a nurse practitioner in Phoenix, Arizona. Again, accurate monitoring is our issue.
Good morning. My name is Bill Barrett. I am the Director of Cardiology in Miramar Beach up in the Panhandle of Florida. And I think our biggest challenge is reliable monitoring and getting the information to the right people.
Good morning. My name is Sean Dyson. I'm with Citrus Cardiology Consultants here in Florida. I'm their IT director, but I have a passion for the device clinic. I've come to this conference in Vegas earlier, and I can't say enough good things about this program, and I'm trying to get it implemented in our facilities, as I think it's going to help us grow tremendously.
My name's Cindy White. I'm the Director of EHR Informatics at Stern Cardiovascular in Germantown, Tennessee. My role with Octagos, correct, is getting the report to our EMR and to our physicians.
Hey, good morning. Eric Olson, run the operations for Octagos. Excited to have everybody here and go through kind of what we do. And really this is for you to share with each other. It's less about hearing from Octagos and more about customers, current customers, potential customers, people that are getting ready to onboard, or customers are getting ready to onboard, and just spurring discussion amongst each other. And feel free to fire away, ask the difficult questions, and we want to make sure that you come away with a good level of knowledge in terms of anything that's in the back of your mind.
Good morning, everyone. I'm Rochelle Robinson. I'm with Florida Cardiology. We are an independent practice in Orlando. We've got about 10 office locations, 17 cardiologists, and are pleased to say we've been with Octagos going on 2.5 years. They came in at a time when we were cleaning up a mess from a prior remote monitoring company. So it's great to see Sybil and Eric and some of the team that really helped us through getting our devices all under a clean platform. We are excited to say that we have actually integrated our EMR. That happened recently, so that's probably been one of the best parts of the platform. And then most recently, 2 months ago, maybe a month and a half ago, we went live on their wearables. So we're excited to have now an extended relationship with Octagos, and I'm just happy to be here to learn some more.
When I think about artificial intelligence, people oftentimes don't have great understanding or even a great impression of it, right? I mean, when people think about artificial intelligence, they think about that character in Lost in Space, the robot that follows the kid around. or they think about something else. And to us, artificial intelligence, I really call it real intelligence because it makes a real difference for patients and clinicians at the end of the day.
We're one of the newer companies in the space, but we're being picked up very rapidly, and that's for a lot of reasons that I'll describe.
We typically have users from the billing side, users from the clinic side, from MAs to NPs, of course, providers.
We want to meet your requirements in terms of data preservation, and we understand, especially with complicated practices, that's an important piece.
We are at the doorstep of an incredible change in how we're going to move forward, and it's going to be, a lot of it's going to be related to this. So this is already being employed, and we need to employ it, and Octagos needs to employ it to make our lives easier.
We're a very flexible company and customer focused. So we really try to make sure we work with you guys as more of a partner, so not just a vendor. So we really want to get in there, understand your business, and understand how we can help and aid into it.
So if I'm on one side of town and I get a text or an email, I can go in and print to any printer in any office, any of the 9 offices, that actual report in less than a minute. That's pretty impressive.
That 5 years from now, as you're looking at where to invest your money in your 401k or 457 or your IRA or whatever, that you will dial up and say, CBA USA, publicly traded. I want to bet on the future of cardiology. And you'll be able to write a check and be a shareholder too.
We help you identify different patients who may need different procedures. And in this one, we're looking at those who need AFib ablations using different criteria.
Staff were worried that they were going to lose their job because we were going to do better. And we didn't lose any staff, but what we actually did was make the staff much more efficient, actually do things that they like doing. So instead of scanning things in and printing out things and doing things that were not at the caliber of what they do, they have more patient interaction. They actually can learn more about the arrhythmias and stuff like that. And actually, they're much happier from a job satisfaction standpoint. And as I showed you guys before, you have the ability to generate revenue to hire more staff with this, which is, to me, was a novel concept.
We utilize our platform to provide data. I mean, I heard it over and over from you guys. We want time efficiency, we want accurate information, we don't want things to fall through the cracks. I mean, these are sort of all the principles that Octagos has been built on. We have leveraged technology to help us do that really well, to provide really accurate data to you in taking care of your patients, and I think that's why we've become the fastest growing company in our space that offers comprehensive device monitoring.
I'm Dr. Shanti Bansal, CEO and founder of Octagos Health, and today I'm really excited to have Amber, who's director of the Virtual Care Center from Advent Medical Center, here today. Amber, thank you so much for joining us. Can you tell us a little bit about how you've been working together in collaboration with Octagos Health for the Virtual Care Center?
Sure, absolutely. What we've done is we've been able to centralize our processes for all of our wearable monitors, all of our CRM patients, our pacemaker ICD patients, as well as our RPM patients. So now we're able to manage all of our patients with one data portal entry, and we're able to track all of the patients in a seamless manner. It's really allowed us to create the centralized process for our enterprise, especially due to the volume just becoming so large. We weren't able to manage it any further at our current position before meeting Octagos and being able to make this expansion.
No, thank you very much for that insight. I imagine that with so many physicians, nurse practitioners, it must be a challenge keeping up with thousands of patients who are potentially having events on a very regular basis, such as critical arrhythmias, heart failure events, and other potentially life-threatening situations.
No, it is. It is. It's very important to understand the importance of this data and how critical it is. And when you're in an enterprise such as ours that does span across the nation, it's important to be able to service different dynamics as you do encounter these different locations. So for us, we've been able to now implement a safe model to follow our patients, and it doesn't just protect our patients and keep them safe, it's also keeping our providers and our staff safe as well.
Amber, we can't thank you enough for the partnership with Advent Health. We're working with a very high level organization, really the best in its field, and they're in and day out saving patients' lives. And from the Octagos Health standpoint, we're providing the data for you guys to be able to do what you need to do. And we feel proud that we're able to help you with that piece of the puzzle. So thank you very much for allowing us to work with you and hear the insights from the experiences from Advent Health.
Very excited to see the continued growth as we continue to expand this through our entire enterprise on many levels.